Hello everyone, today we are going to present a presentation on the topic
General signs and symptoms of illness in babies.
Myself Riya
Alovisha.
and here we begins. So moving towards the first slide, caring for a baby becomes with a lot of joy but also many concerns, especially when they show signs of illnesses. Since baby cannot communicate their discomforts in words, it's important for parents and caregivers to recognize the signs of sicknesses early. In this presentation, we will discuss the general symptoms of illnesses in babies, when to seek medical help, and some ways to prevent common illnesses. Understanding these signs can help caregivers take actions quickly, ensuring the baby's health and safety. So, moving forward,
Let's start with some general signs of illness that often indicate something is wrong. One of the most common symptoms is fever. A fever in babies under 3 months old, especially if it reaches 100.4 degree Fahrenheit or higher, should always be checked by a doctor. Fever can be a sign of an infection, so monitoring temperature is important. Another key symptoms is extreme tiredness. If a baby is unusually difficult to wake up or less active than usual, this could signal illness. Changes in feeding habits are also important to note. A baby who suddenly refuses to eat, drink much less milk, or has trouble sucking could be experiencing discomfort or illness.
respiratory system can also be a sign of mild cold, but they can also indicate more serious conditions like coughing can range from mild to severe. A persistent dry cough might indicate a virus, while the breaking cough may suggest crop. Whistling or noisy breathing can be a sign of respiratory distress or an allergic reaction. Fast or difficult breathing is a red flag. If a baby's ribs are pulling in with each breath or they are breathing more than 60 breaths per minute, immediate medical attention is needed. Nasal connections is common but can affect feeding and sleeping. If a baby is struggling to breathe due to congestions, and it's important to clear the noise and monitor their symptoms. We can have a view to this video we have attached how the baby is normally breathing and how is abnormal breathing, like how he's crying and having a deep breaths and a faster breathing.
Digestive symptoms. Now let's discuss digestive symptoms which can sometimes be alarming for parents. Vomiting occasionally is normal, but frequent or forceful vomiting could be a sign of infection, reflux, or even the intentional blockage. If a baby is unstable to keep any fluid down, dehydration becomes a risk. Diarrhea can lead to dehydration, especially if it's happened multiple times a day. Parents should watch a sign of dehydration like dry lips and fewer wet diapers. Constipation is not always a sign of illness, but if a baby had a swollen belly, pain, or hasn't had a bowel movement in several days, it could be a problem. Bloating or excessive gas could be a formula intolerance or mild infection, but should be a monitor if baby is distressed.
Talking about skin and physical symptoms. Physical symptoms, especially those visible on the skin, can provide clues that the baby's health. Rashes are common in babies, but some requires medical attentions. A rashes that does not fade when proceed or one accompanied by fever could indicate a serious conditions like meningitis. Swelling or lumps could also be a sign of infections or an allergy reactions, especially if they appears suddenly. Skin color changes should always be taken seriously. Pale, blue, or grayish skin may indicate breathing problems or circulatory issues and requires immediate medical attentions.
Dehydration and other serious signs. Dehydration is a serious concern in babies, especially if they are vomiting or have diarrhea. Signs include fever, then 6 wet diapers per day, sunken soft spot on the head, dry mouth or no tears when crying. Other serious include seizures, unresponsiveness, or a high-pitched weak cry. These requires urgent medical attention.
Now we have discussed all the symptoms and we have discussed all the diseases we can feel in babies. Now moving forward, when to seek medical help, because these symptoms are very general in babies. Now it's important to know when to seek medical care. Parents should contact a doctor if the baby is younger than 3 months and have a fever of 100.4 degree Fahrenheit, that is 38 degrees Celsius or higher. There is a trouble breathing, whistling or blue lips. The baby refuses to eat for multiple feeding in a row. Vomiting or diarrhea cause dehydration signs. There is an unexplained rashes, swelling or extreme irritability. If any situation when a caregiver feels something is serious wrong, it's always better to seek medical advice.
Prevention and care tips. While illness can't always be prevented, there are steps caregivers can take to reduce risk. Hand washing is the best way to prevent infections. Keeping up with vaccinations protect against serious illness. Ensuring babies get enough rest and proper nutrition helps to their immune system. Avoiding crowded places and sick individuals during flu seasons can reduce exposure to germs. Early detection or quick action can make a big difference in managing illness.
Hey, so here we came to an end. It's a conclusion of our video. To wrap up, we have described the general signs of illnesses in babies, including fever, changes in feeding, respiratory issues, digestive problems, and the skin symptoms. Recognizing these signs each can help caregivers seek timely medical care and keep their babies safe. If the baby shows any red flag symptoms such as difficult breathing, high fever, severe dehydration, and unresponsiveness, immediate medical attention is necessary. Thank you everyone. Thank you Lavisha.
Thank you.
Thank you for being with us. Thank you for listening us. We hopefully